All right, you guys. So let's talk about these SOAP notes. As I was explaining with these notes each week this month, what I will do is what we're talking about is included in here. And since this is the first week, I'm going to break down what a SOAP note is, and then I will incorporate the stuff that we discussed in topics and tips and work it out Wednesday. Okay. All right, you guys. So, I always like to give you the introduction with all of my videos to let you know one, for you who support me, have been following me, welcome back. For those of you who are new to me, I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. And with these videos, I like to give the introduction and disclaimer to just let you know that these are designed for nurses and nurse practitioners to help you guys prepare for boards and practice. It's not all encompassing, it's not for sole treatment purposes because we handle patients on a patient by patient basis, but this is to get you ready confidently for boards and practice. Okay. All right, you guys, let's get into it. All right. SOAP is just an acronym that we use in healthcare for our documentation. You're getting a lot of information. We need to document these things. We need to have those sources that we can quickly look at and identify. And it helps when you're reviewing other documents and medical histories and doing consults and grouping things together when we all kind of flow in the same format to quickly identify what's going on and put these puzzle pieces together, right? So again, this is an acronym to help with the documentation in the healthcare field. So S stands for subjective, O stands for objective, A is for assessment, and P is for planning. All right, so let's talk about subjective. Subjective is exactly what that means. And so, where I always tell people, think of that as when it's subjective, what is the patient stating? What is their chief complaint? And when you say this, it's like, how you start to think of how they presented to you in the office, if you're even making rounds in the hospital, whatever the setting is, what are they stating is going on? What are they explaining to you? I don't want you to tell me anything that you are observing, but more only in this section. Tell me what they're complaining about. Tell me what they're stating, even if it's good, the positives. If they're telling you everything is normal, this is the section to put this, and then also including that history of present illness, okay? Now, yesterday, when we were doing the Work It Out Wednesday questions, there were three questions, but I'm just going to hit on two of these because they had a scenario and we'll kind of build on that. But the first one is a 39-year-old female presents to the office today with complaints of feeling depressed. She states that she has had difficulty for some time now, but most recently noticed the inability to get back to herself. She states that she has no interest to do the things she loves and is often tearful. Thyroid panel is normal. Which drug class is commonly prescribed for major depressive disorder? All right, so that was the question, one of the questions on yesterday, right? So with that one, subjective, what you would put here is where she's complaining of feeling depressed. That's a statement, that's a chief complaint. She's having difficult. She has had some difficulty for some time now, but most recently, she has noticed that she is unable to get back to her normal, feeling like herself is what's stated. And so, with this, also, we'll go a little bit deeper to ask more questions, and I'll tell you in more sections as we progress through the acronym. But also, it talks about her having a lack of interest to do the things that she loves. It says that she states that she's been tearful, right? So, all of this is subjective. Also, in this, for the HPI portion that you can add to this section, is basically everything I just read. So, a 39-year-old female presents to the office today with complaints of feeling depressed. She states that she had the difficulty for some time. That's all that subjective factor, we're adding in there, right? So that's what you're putting here because that's starting you off. Now, present illness, when she says she's been dealing with this some time now, I would ask her, have you ever been diagnosed with depression or treated for depression and those things? Because there you can state she has a history of depression or whatever other medical history that she has. And I really like to put that here because you start with this S, and I think it's so helpful across the board because it allows you to go back when if a person is returning in the office for you for follow-up, to quickly look back and see what was going on, see what type of history she has, etc. But also if you're doing a consult and somebody's looking at it, or the person moves to a different area, they have this foundational knowledge, right? So again, I know I just gave you a lot, but subjective is that chief complaint. What are they saying is going on? What are they stating? Any of the questions you ask, y'all know I do a lot in cardiology. So things like, have you had any chest pain? Patient denies chest pain. Patient denies any changes in appetite, so anything like we're talking here, this is more along the lines of depression. You can ask if they are having any thoughts of harming themselves. Patient denies, you put all of that in the statement of what is subjective. What are they complaining? Start with that chief complaint and include all of these things. So what are they stating? All right, so next, objective. So we went from subjective, what are they saying is wrong, to objective, what are you observing? So what do you see is going on with this patient? So as we're talking about this, how does she look? You're going at appearance. Is the person well dressed, well groomed? Because sometimes if we're talking depression here and she's saying she has a lack of interest, you may notice that she, hasn't done her hair, and you're in previous visits, you notice that she really does these things. Not to say that that gives you the diagnosis, but you notice and observe those changes, or you'll say, she looks well, she's well groomed, she's still maintaining those areas. Or you observe that she appears anxious, she's fidgety, or is she having a flat affect? What are you observing here? When the vital signs have been completed, you can put those there as well, in this area, because this is tying everything together of what you saw. We went from, hey, what brought you here? And the way I like to start with patients when they come in, I introduce myself and I'm saying, I say, are there any concerns you need to talk to me about today? Or what brought you in today, if it's not just a general follow-up appointment? And just building like that. So then that's how you get that subjective. Then we get our objective for what you observe. And I just want to throw this in as I'm going through this. A lot of times people ask me, how I navigate through this, because, we're asking a lot, we're completing a lot, we're assessing a lot. And sometimes people want to give you a dissertation on what's going on. And we're not trying to rush them through, but you're trying to get the full picture and effectively treat this patient, right? So I am big on grouping things together. So when I come in, one, I've already looked at any information that I have on you. If I'm in the hospital, you might not have much, but you try to get a foundation, right? So then you go in, you're again starting off. What brought you in today? Or any concerns you need to discuss with me today? And then we go through that. I listen to your statements. I start to observe as I'm listening. All of this is active, but we're breaking this down. But then I kind of group things together. Have you had any chest pain, shortness of breath? Any changes in appetite? How about any changes in bowel or bladder? Any difficulties with urinating? When was your last bowel movement? Have you felt dizzy? Have you had any swelling in your legs or feet? I just kind of group everything together because in our mind, we're starting to think through all of these systems as we go through. So I group it and we're forming a picture. And then when we come to this SOAP note, we are breaking it down into these subgroups. So again, S is for subjective. We're putting what they're saying is wrong. What is that chief complaint? What is that history of present illness? Objective, we're observing what do we see going on and those vital signs we have in there. And so with that, when I gave you, it was a quick practice question, so I don't have vital signs in that question, but you would put all of that there. And like I said, we would put if we observe that she might seem anxious or any changes in her appearance or anything of that nature. All right. So the A in the acronym is assessment. And assessment, what I tell people is it's just basically a summary of you just tying everything together of what you assess. Like what are you starting to think is the differential diagnosis and listing those out. This assessment is, hey, this is what I've built based off of what you said was wrong. I observed what's wrong. I am putting this puzzle together. I'm giving you this summary. I'm coming together with what I think. So with this, patient had a history of this, and she's starting to feel more dissociated from things that she enjoys doing. She has a lack of interest. She's tearful. It's been greater than 2 weeks. And then differential diagnosis, major depressive disorder, etc. You're going through that list of things and you're adding that all of that assessment. So you have a quick little summary of what's going on and then kind of list out those differentials. Also, in that question, it spoke of the thyroid panel being normal because as you're building these things, you want to make sure you're ruling out those areas that could contribute to these signs and symptoms or the complaints that the patient is having. And so that's also contributing to your differential. And then lastly, P is for planning, and it's exactly what it says. So what is your plan on treating this patient based off of that assessment that you have tied together? So we're starting to believe that this patient had major depressive disorder. So then how do you plan on treating? She's not currently on anything. And so with this, that's what the question was asking on yesterday. If you haven't seen it, go back and check it out. But SSRIs, that should be the first thing that popped into your mind because that's one of the most commonly prescribed treatments for, or the antidepressant is what I should say. It's the most commonly prescribed antidepressant, SSRIs. And so you would think through the class that you think that fits best with this patient. Okay? And with this, you'll go into detail to say how you plan to treat, when you will have them back for further evaluation. So, for example, if we're doing an SSRI, saying, the particular SSRI that you decided to go with, so if you're doing Zoloft, given the dose, the route, how often, and then when will you have them follow back up? Are you going to have them back in a week, 2 weeks? Typically, to kind of see how they're doing so that you can gauge how they are responding and evaluate how they are responding to the treatment. Typical antidepressant, it takes about 2 to 3 weeks before you'll see effectiveness. So getting them back in those period of time to evaluate the patient and see if there needs to be an adjustments. But that's where you include these things because this is to tell a story. You should be able to quickly identify all of those things. But the SOAP is such a great tool because it makes it easy to go back and see, like, for example, if you're doing a follow-up, when you go back, you go straight to your plan to see what did you do last time? Let's see what I did. Let's see what worked previously or didn't work previously so you know how to move effectively, right? But let's start from the top one more time. And kind of go through it. Acronym SOAP, right? S is objective. So what are they stating is going on? Chief complaint, HPI. So that's where it starts off. 39-year-old female presents to the office today with complaints of, feeling more depressed than usual. She's tearful. She has a lack of interest of things that she normally loves, etc. She denies any thoughts of harming herself, any attempts of harming herself. She denies any chest pain. She denies any previous history of thyroid disease. You're going through this whole thing. You can include the medical history. I like to put that there to give a foundational piece, but just remembering it's subjective, right? All right. Objective is observing. So what I see, patient has a flat affect today, typically well groomed. She does appear a bit disheveled, etc. I'm laying the foundation. I'm putting the vital signs. Or if everything looks normal, you put everything, whatever it is in that spot. Then rolling into assessment, like I said, it's just basically a brief summary of what you've tied all together based off of the things that you have pulled and put together from the visit in your exam, right? And so you will put all the things from that assessment. And so I like to include in that, I break mine down into my differentials into a list format and give a little brief summary under that particular differential in that area so that I'll know that I want, so that you're able to see those the assessment and the things that you tied together that gave you those differentials, you know what I mean? And so again, it'll be like major depressive disorder. um Patient has had lack of interest and been more tearful over the past 2 weeks, has a previous history of it, you know, never been treating, will initiate Zoloft and continue on with the dose and have patient to follow up in 2 weeks, etc. In the plan. And you kind of just break that down into those differentials. And I've done it from various sides. So even from a hospital perspective, it's going to be more frequent because you're consistently working through that. But I just want you to picture it from that standpoint. All right, so let's start with the other scenario I was telling you about from the other practice question. This one states a 72-year-old female returns to the office for follow up. She has a history of hypertension, anxiety, depression, and anemia. She states that she would need to be restarted on an antidepressant as she has not taken one in years, but knows that she needs it. And the rest is just talking about prescribing the question, right? So now that we just kind of went through one, let's kind of go through this one briefly. So, subjective, her chief complaint is her depression. She does have a history of depression, also anxiety, anemia, and hypertension. You would include all of that. But in that chief complaint, we would start it off with that. Um, so that's why this is basically set up that way in the question. She's 72 years old. That gives you a foundation of age. She's female with a gender. This is a follow up. I like to include things like that so you know that we have, been following. Um, and then her statement. So she's wanting to answer the breast. So you're going to want to elaborate to get more on that statement. How long have you noticed any changes? You said that you've been dealing with this in the past. When's the last time you took an antidepressant? Which one did you take? Did it help you? Did you notice any changes, any benefits? So that you're able to say, patient states she took Zoloft in the past. She found it helpful, but stopped, blah, 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 blah. Whatever, is going to be that foundational information, but putting in her statements, okay? Um, Again, she denies wanting to harm herself, things of that nature, all the stuff. She denies any chest pain, any dizziness, etc. Objective, we will include those vital signs, what we observe, showing anything if we see any changes in how, she has a history of anxiety. Does she appear anxious? Just like we talked about, okay? And you just want to put that in a brief scenario because all this end up just building that initial paragraph. Um, the full-on assessment is included. You'll see that on a system-wise approach. And then, when you are an assessment, like I said, this is just basically a summary of what you have assessed and tying it all together. So given that foundational piece, saying here, she already has a history. So you would just list out, you can put major depressive disorder. You can put generalized anxiety. Um, you can put the hypertension, you can put anemia, you can put all those things down. But the main two, major depressive disorder, generalized anxiety, putting a brief blurb, patient had a history of this, previously took Zoloft, states that it worked, patient decided to stop. She was provided education to not stop abruptly without medical advice or tips to stop this, will initiate Zoloft, et cetera, et cetera, et cetera. Also, we would initiate Zoloft because I want you to think of it too. That's one of the friendly medications for our elderly population, one of those SSRIs. Go back and check out the videos because I go through that too from this week, but still it would be good for her age group. So she took it in the past. It was well. It works for her age now. So continue on Zoloft, have her to follow up in 2 weeks, etc., etc. That will be in your plan. But in this assessment part, and I'm telling you all the plan like that because if you think about it, A and P is usually together when you see it. So the assessment, you list out those summaries under the listed differential diagnoses that you have on here, your diagnosis, and then those planning, like how you're going to treat. And I just kind of said all that into one blurb. Now, I know that was a mouthful. I know that was a lot, but hopefully this helped you to break it down, and you can slow it down, pause it, write this out, so that you can do it yourself, as well. And I'll kind of put some notes too for it, but slow it down, write it down if you need to, pause it, go back, think through it if you want to, as I am going through each stage, because when you're used to doing it, it kind of just rolls off your tongue. So hopefully this helps to briefly tie that together. But as always, I like to tie in how I associate this with board preparation. Now, you guys know that I always tell you to think assessment, diagnosis, evaluation, and treatment when thinking about boards. So now that we have broken down the SOAP note, I want you to be able to see how this applies in the fashion of data. So I put it in this chart format to kind of let you see it as what I'm typically talking about, and you'll kind of be able to make a correlation now that we have talked about the SOAP note. But I always say this is how the test is actually providing for you. So if you think about the question style that I just told you guys, so the question format that I reviewed before we broke down the SOAP note, so that you can see how that's broken down, but also kind of see how that brief scenario is put in place. That's the same way the test is going to give it, but they want you to pull from this to test your knowledge in these 4 areas that I have listed that you always hear me talk about in my review stuff. So with assessment, it's looking at those signs and symptoms, right? So how is that person presenting? So what falls under that assessment is that subjective and objective area. So signs and symptoms, what is their chief complaint? What are they saying? Are they complaining of a runny nose? Are they complaining of a fever? What did you observe? Did you notice any sweating? Did you notice any shortness of breath, et cetera, et cetera? So those signs and symptoms, that presentation, it falls under that assessment category that they list on boards and check for when testing. So that's that subjective, objective, right? Diagnosis, those are the differentials. So that follows under diagnostic exams that you would do, in the differentials you formulate, right? Then evaluation, I like to kind of do evaluation and treatment. So sometimes you do the treatment first. So how we spoke of prescribing that SSRI, but bringing them back in 2 to 3 weeks to evaluate how they are responding to treatment and seeing the effectiveness of therapy for that particular patient. So that's what this is. So in this scenario, let's go from the first patient. 39-year-old female has lack of interest in things that she loves. She's feeling more depressed. She's tearful. That's the assessment category, right? And that's what's starting to make you think in the diagnosis fashion, those differentials, right? Is where we start to think major depressive disorder, minor depressive, bipolar depression, different things, generalized anxiety, any of these things we're starting to work through. When you're asking how long, because major depressive is when they have these symptoms for greater than 2 weeks. She's been dealing with this for some time. We're thinking major depressive disorder. These are those differential diagnoses. We're doing the extra tests like the thyroid panel to rule all that out. All of that falls under that diagnosis panel. And then treatment, we went with the SSRIs because guess what? We know from studying, because if you study in this fashion, that SSRIs are the most common antidepressant prescribed, right? So when we utilize those, we want to start going through, and for this, we can look at it for the elderly population, where we look at the ones that are more friendly for them. So like those Zolofts, the citalopram, but for that 39-year-old female, if we went for a Zoloft, a Paxil, anything, we knew that SSRIs was the first class we want to go through. So we're able to break that down. But we also know that the effectiveness in most antidepressants is like that 2-week span. So bringing them back for a follow-up and evaluating the effectiveness, that's what they're looking for in that. That's how they're grading. That's why if you look at the blueprint, see it broken down in this fashion. That's why if you've ever been unsuccessful on boards, they will give you this saying whether you're stronger or weaker in these areas. And that's why I teach you in this way, because guess what? When I say this is how we prepare for boards as well as practice in this fashion, I teach you because you see how closely it goes along with the SOAP note. It ties all together. So I hope this was helpful, you guys. As always, thank you for watching. Please like, comment, and subscribe, and share with a colleague, friend, or whomever you think that may find this helpful. But be sure to meet me back here next week. We will continue doing this through this month, and I hope that this is helping to kind of tie it all together for you. Leave in the comments if you have any questions or want me to elaborate or go into detail or provide any additional notes, because as we do it through the month, I can add some more things. But I really wanted to get this in a not too long video, put it together with what we studied, give you the basics and the foundation of it, and then tie it all together to apply it to boards as well. All right, you guys, meet me back here. Bye, y'all.